the CEO of HARC, Dr. Jenna LeComte-Hinely. And Jenna is here to talk about something very important called Take the Call. And first, let me back up. You've been on the show before, but folks may have not seen you. So explain to them what the nonprofit HARC that you work for and that you run is all about here in the Valley.
Absolutely. So HARC provides research and evaluation services to organizations throughout the Valley in support of health and wellness. And a big part of what we do is that every 3 years we do this huge survey of the health of the Coachella Valley. And we actually give that back to the community at no charge. So the survey is immense. It covers things like healthcare access, utilization, health behaviors, major disease, mental health, the whole 9 yards. And the purpose of this is to really give us a good measure of what our health is here in the Coachella Valley, because Riverside County is a big place.
Sure. And
county level data is fabulous and it's freely available, but what describes the people in Riverside isn't necessarily what's going on here.
That's very much true, I would say. So explain to folks then the importance of when they get this call, and the reason Jenna's here to talk about this thing called Take the Call. It's a big campaign. You've teamed up with Kent University back in Ohio. They're going to be doing the phone calls for you. This will be at random. They'll be calling people and asking them questions about their health and their lifestyle. How is this data then used so it helps me, my daughter, my family here in the Valley when it comes to maybe healthcare, my healthcare costs, where I eat, how I do business, things like that? This information is used in a whole wide array of areas, but people probably don't get it. Explain that to me.
Absolutely true. So our data is available to anyone, and many of the people who use it are nonprofits and healthcare organizations, governmental agencies, and the data is really helps you make priorities and prioritize health needs and get funds to address those needs. For instance, we're very, very proud in that in the past 5 years, several dozen organizations, nonprofits in our Valley, have brought in over $12.8 million in funds to the Valley to do things like counseling for children in schools, free HIV testing for everyone, home-delivered meals for seniors who are homebound.
And we wouldn't know that we needed more of those funds to go to those types of programs, like Meals on Wheels, like more AIDS help for AIDS patients, unless you guys did these surveys every so many years.
Exactly.
Correct?
So the numbers make a really compelling story and make them much more likely to get funding. I have one person who gets funding is the Meals on Wheels program at Mizell, and their director of development, Jack Newby, has said to me that if you're applying for funds outside of the area, people have this stereotype that it's Palm Springs, it's rich old white guys playing golf, which is not to say that's not true. Part of that is true, but there's another hidden story.
There's a lot of diversity in this
There's
valley.
a lot of diversity, a lot of poverty, and our data helps tell that story. So we're here today to ask you that if you do get the call from Kent State on behalf of HARC, please do take the time to answer it. It's completely confidential, and it really, really will help the community.
I know one of the last surveys, and we got to wrap it up, they're wrapping it in my ear, but I know one of the last surveys you did showed that we have a big bad problem with obesity, especially on the east side of the Valley and the Hispanic community. So that was something that your last survey showed. This one will show where we've gone up or down, and maybe that will put more funds to help combat that with maybe education in schools on the east side of the Valley, healthier meal programs, right?
Exactly.
Is that a good example?
Exactly.
Okay. So there you go, folks. It's on the screen. They started making these calls at the beginning of the year. They're going to last now March through May. So again, if you get a phone call, I know we get those calls all the time, somebody trying to sell you something. If they say they're from Kent University and they're doing the HARC survey, take the call. It's just a few minutes. Answer their questions. It really matters when it comes to the health of our Valley, and this is where we live. Thanks for coming in, Jen. Appreciate it.
Thank you.